You've probably heard of allergy shots, and for decades, they have been the gold standard for long-term allergy relief. But they've also meant years of weekly visits, hundreds of injections, and a huge time commitment. What if there was a smarter, more precise, and faster way? Hi everyone, my name is Dr. Kara Wada. I'm a quadruple board certified allergy, immunology, lifestyle medicine physician. Today we're breaking down the difference between traditional allergy shots and what I like to call precision allergy shots like intralymphatic immunotherapy. We're going to help you understand who might benefit from this more modern, targeted approach and whether it might be for you. Let's start with what most people know is traditional allergy shots, which we call subcutaneous immunotherapy. The nickname is SCIT. With SCIT, you receive regular injections of diluted allergens, the things you're allergic to, like pollen, dust mites, cat dander. These injections are given into the fatty tissue under your skin, usually in the back of your upper arm. You'll start with a very low dose and gradually increase it over what we call a buildup phase. This typically takes 3 to 6 months of weekly visits. Now, sometimes certain practices will use something called cluster buildup or rush buildup, where this buildup phase is condensed, but it does mean that you're getting a lot of shots in a shorter period of time. Once you reach your maintenance dose or that top dose, you'll continue getting shots every few weeks out to about once a month for a total of 3 to 5 years. The idea is that repeatedly exposing yourself and your immune system to small amounts of this allergen, you're allowing your body to be retrained. You're teaching it to tolerate a substance instead of attacking it. It's a proven and effective treatment, and it works. We've known it's worked for well over 100 years. But it is a huge time commitment, and frankly, it's a pain in the arm. We're talking about potentially 200 or more injections over several years. As a physician and someone who also doesn't really particularly like getting poked as a person, I know how hard, first of all, it is for us humans to stick with something over that long term, to keep showing up, and to do that for something that's pretty uncomfortable. It's often really hard to stick with this treatment protocol. And that's why majority of patients really do have a significant difficulty in sticking with it. Now, you may also have heard of sublingual immunotherapy, allergy drops, or in a few cases, FDA-approved tablets, which work similar to the allergy shots, but are needle-free. These also work in a similar way. Again, you're repeatedly exposing your immune system to small amounts of allergen. You're teaching your immune system to tolerate these substances rather than attack it over the long term. These treatments are typically taken on a daily basis, again, for at least 3 to 5 years of treatment. So if you're someone who has trouble taking a medication every single day, that also can be a real challenge, right? So what makes precision allergy shots like intralymphatic immunotherapy protocols so much different? I want to talk about this more modern approach. We call it ILIT. With ILIT, instead of injecting allergen into the fat under your skin and waiting for your immune system to find it, bring it back to the lymph node, we use ultrasound guidance to inject a very small, precise dose of allergen directly into the lymph node. Why does this matter? The lymph nodes are the central command centers of your immune system. It's where your immune cells gather. They communicate and they learn what to react to and what to tolerate. So when we deliver allergen directly to the lymph node, we're taking the message straight to headquarters. We don't have to wait for those other little immune cells to bring it back there when they want. So think of traditional allergy shots of like sending a company-wide memo and hoping that the right department eventually reads it every week. ILIT is like walking directly into the CEO's office and having a focused conversation. It's targeted, it's efficient, and it's precise. The treatment protocol is dramatically shorter. Typically, you'll receive just 3 to 4 injections total, and they're usually spaced about 4 weeks apart. Our standard ILIT protocol is 3 injections over 8 weeks. And then within the Immune Confident Institute, we typically will touch base with our patients a little bit, a few months out, see how they're doing, and decide if a booster dose is a right option for them. But that's it. We're talking about a handful of visits over a few months instead of hundreds of visits over years. The adherence rate is nearly 100% because that commitment is so much more manageable. Now, the benefits also are clear. Efficiency, drastically fewer injections and drastically fewer appointments. Precision, we're targeting the exact location where immune tolerance is learned, the lymph node. And just to let you know, that lymph node is found just under the skin, and it is no more painful. And actually, many patients who have had regular allergy shots will say it's less painful than what they remember with their typical allergy shots. We're also using a lower allergen dose. Because it's so direct, we can use a much smaller dose of allergen, sometimes up to 100 times smaller than traditional allergy shots. And this helps us with a crucial point in the safety profile, especially for my patients with very sensitive immune systems. And I care for many patients with mast cell activation. Mast cells are the cells that trigger anaphylaxis. They are found primarily in our connective tissue, like the skin, our respiratory tract, mucosal lining, our gut. Very few to no mast cells are found within the lymph node. So by injecting it directly into the lymph node, using a much smaller dose, we're significantly reducing the exposure to the cells that cause systemic reactions. In my mind, it's a much safer, more controlled process, and we only need to do it 3 or 4 times, not repeatedly week after week, month after month, year after year. Now, with any type of allergy immunotherapy, there is a risk of a systemic reaction, and I have had patients have systemic reactions as a result of their ILIT injections. And so we treat this procedure with the utmost respect and preparation. It's like Boy Scout rules, be prepared. But I will say vast majority of our patients seal through, do really incredible, and are having great relief of their symptoms. So who is the ideal candidate for intralymphatic immunotherapy or precision allergy shots? ILIT can be a game changer for several groups of people. First of all, if you are someone living with chronic sinus issues, if you're dealing with recurrent sinus infections, persistent congestion, allergies are a frequent major driver of this chronic inflammation. Targeted immunotherapy can be particularly effective at breaking this cycle, helping turn down inflammation, allowing you to breathe easier, have better control of asthma, all those sorts of things. If you're someone who, you've tried the antihistamines, they're too drying or sedating, the nasal sprays have worked a little bit, but you don't tolerate them real well, or you just don't like them, you're still suffering, it's a sign that symptom suppression isn't enough. I also see a lot of folks who, they're on the antihistamines, they're on the nose sprays, they're on all the things, and their treatments just keep escalating. Those are also perfect candidates often for immunotherapy, and in particular ILIT, which is going to address the root cause by retraining your immune system so it no longer is responding to the things that keep stoking that fire. If your immune system is already on high alert from an autoimmune condition, a more precise lower dose approach like ILIT is often better tolerated and a smarter choice as well. So it's a great choice for those folks who are living at that intersection of autoimmunity and allergy. If you're a busy professional, a parent or a caregiver, you simply do not have the time for weekly appointments, and let's be honest, many of us don't, the efficiency of ILIT is transformative. That's why I have people flying across the country to come see me, because in their mind, spending 3 days traveling is well worth the time and money investment so that they don't have to keep going back to the office week after week, month after month, year after year. This is also a really great option for patients who didn't tolerate traditional shots well. I see a lot of patients who had to stop traditional shots because they would get real large local reactions. They had anaphylaxis to their regular allergy shots. They just didn't feel well on them. Since ILIT uses a much lower dose, has a lower incidence of local reactions, it can be a wonderful second chance at achieving lasting results. Now, I will say we are injecting allergens, and it is not uncommon to see some local reaction at the site. But think about only having the opportunity to have that happen 3 or 4 times as opposed to, again, week after week, month after month, year after year of those sore, swollen arms. So what do realistic outcomes look like? Talk about expectations. The goal of any immunotherapy is not to make you 100% allergy-free forever. The goal is to significantly reduce your symptoms so that you can enjoy a life with minimal to no medication. It's about preventing your allergic disease from progressing, and for those of us with autoimmunity, reducing a major source of chronic inflammation, which is going to work in the benefit of our long-term health, right? Pivotal studies have shown the effectiveness and the long-term benefit of intralymphatic immunotherapy, or ILIT, is comparable to that of traditional allergy shots. And in my own clinical experience, seeing patients get better so quickly is really life-changing. I just saw a patient back between her second and third visit. She has 2 adorable little kittens at home that she loves dearly, but we're really stoking her allergies and we're increasing some of her autoimmune symptoms too. And she was already noticing that she only had needed to use her Zyrtec a couple of times between our second visit and our third visit. Now, this is a little sooner than I would typically, tell patients that they should be seeing symptom improvement. But goodness, really incredibly rewarding to see someone going from being miserable and needing all these meds to being able to enjoy, the outdoors again, enjoy snuggling with their little fur babies again. It feels really good. So is this approach right for you? Now, I want to be clear. Intralymphatic immunotherapy is considered an off-label use of FDA-approved allergen extracts. It is not currently covered by insurance, and this is a topic my colleagues and I discuss often. These extracts are the same exact ones we use for traditional allergy shots. They're the same exact ones we also use off-label for sublingual immunotherapy drops. Because sublingual immunotherapy and ILIT are used off-label, because ILIT uses so much less of the product, there isn't a strong financial incentive for large companies to push it through the lengthy and expensive FDA approval process for this specific method. However, for many, the out-of-pocket cost can be a significant cost savings compared to years of copays, years of taking time off from work, and the ongoing medication costs. We do offer payment plans, and you can often use your HSA or FSA funds to make it more affordable. My belief is that every patient deserves to know all of their options. The only way to know if ILIT is right for you is to have a detailed conversation with an allergist who's an expert in this procedure. We often will do allergy testing, or if you have recent testing, we'll review that testing, review your full medical history, and then together we can make an informed decision. To find a qualified physician, I highly recommend checking out the ANI ILIT Learning Network. It's a group of physicians that I'm a part of who have deeply invested in their learning this technique and are truly committed to staying at the forefront of this science. Now, allergy season is coming quickly. If you want to start immunotherapy and actually see benefits this spring, you need to start real soon. I'm currently offering a limited number of spots in my preseason Precision Allergy program. This includes comprehensive testing, a personalized treatment plan, the ILIT procedure itself. It's all designed to help you get ready before this heavy pollen season hits. If you're interested in exploring whether Precision Allergy Shots might be right for you, use the link in the description to apply for initial consultation. We'll review your situation, see if you're a good candidate for this transformative approach. Next week, we're going to switch gears back again. We're going to talk about high cholesterol and autoimmune disease, particularly Sjogren's. We'll cover the 5 key questions you should ask your doctor before saying yes or no to a statin. Make sure you're subscribed so you don't miss it. Today's video was helpful. Give it a thumbs up, drop a comment below. Have you tried immunotherapy before? I want to hear about your experiences. Thanks for being here, and until next time, I'll see you.